Welcome everyone, Dr. Naveen here from UPSC MEDICO. There is one topic that I would like to discuss here in this video, that is ARI protocol. This is latest update, what you need to understand. As per latest update, as per WHO. Now what is this ARI? This is Acute Respiratory Insufficiency. Now we all know one of the important cause of childhood mortality is pneumonia, right? So with simple techniques, with simple clinical features, you should be able to classify pneumonia and treat to prevent mortality. So that was the main intention behind coming up with this ARI protocol by WHO. Now this WHO has a as I said, this ARI is a clinical classification based on the clinical features. We are not wasting time in investigating or doing a chest X-ray and all. Those are done in tertiary setup and the disease is managed according to the cultural report. Altogether a different way of handling pneumonia cases in a tertiary setup. But this is purely a clinical classification what we are talking about. Now here in this, one more important point you need to understand is that we are only focusing on the age group 2 months to 5 years. Okay, as per the IMNCI protocol also it is included, this ARI protocol, 2 months to 5 years we are only focusing. So we are classifying treatment in children aged 2 months to 5 years who come with cough or difficult breathing. These are the symptoms they present with. And one more important prerequisite to understand this topic is to understand what is known as fast breathing or difficulty breathing or fast breathing. Now, the fast breathing is all about respiratory rate. Now, let's look at the respiratory rate, which is classified as fast breathing in age group 2 to 12 months and 12 months to 60 months. Okay. If it is less than 2 months, the fast breathing is more than 60 per minute. Okay. If it is 2 to 12 months, this is more is important because we are only looking at 2 months to 5 years. More than or equal to 50 per minute. Whereas 12 to 60 months, more than or equal to 40 per minute. This is important because I had seen in IMNCI and a NEET PG exams, they're giving you respiratory rate as a, I'll take an example. They're giving you respiratory rate as 50. And the age of the patient, they're giving respiratory rate as 40 and age of the patient is 13 months. Now there is a confusion. Is it only more than 40 or more than or equal to 40? It is more than or equal to 40. So 40 onwards, 39, 38. Okay. So these are not fast breathing. 40 and onwards, 41, 42. This is fast breathing. Okay. So when you check respiratory rate of a 2-year-old kid, if it is more than 40 or equal to 40, you should be worried because that comes under the criteria of fast breathing. Now let's look at the protocol in general. Okay. Now previously there used to be a classification as severe and very severe categories, but now we only have one category, either pneumonia or severe pneumonia. So let's look at different categories. Okay, first we'll look at the category. So there are 3 categories as I said. So the category is just cough or cold. Next, pneumonia. Now pneumonia with or without lower chest indrawing. There was a previous WHO classification which was not modified. In that, chest indrawing used to indicate severe pneumonia, but chest indrawing has become so common nowadays. It is attached with pneumonia. So even there is a lower chest indrawing, we call it as a pneumonia, but pneumonia with lower chest indrawing or pneumonia without lower chest indrawing. So they both come under pneumonia category only. Now finally, the next thing that we have is severe pneumonia, right? So these are the 3 categories we have. Now, when I look at cough or cold, let's look at the features of this category. So you need to understand that in this category, there is no fast breathing. Now, what is fast breathing? I already gave you the respiratory rate, which classifies any increased respiratory rate as fast breathing based on the age. So there is no fast breathing, no indicators of severe illness, and only there is cough or cold. So these cases of just cold or cough, what we need to do is the treatment part. What we are going to do here is home care. So we're not doing anything else apart from home care. So we will be giving some home remedies for cough, and if there is fever, it is managed with paracetamol. So let's say you are now practicing as a physician in a primary healthcare setup. There is a 3 months old kid coming with complaints of cough or cold. The first thing that you need to do is check the respiratory rate. If that rate is coming under fast breathing, then it is pneumonia. Immediately check for chest indrawing and also check for saturations. The saturations are normal saturations. There can be lower chest indrawing, which can be present or absent in this category. So now we classify it as pneumonia. And yes, even in this category of lower chest indrawing, we do home care only. No need to admit the patient, but this case requires antibiotic with amoxicillin. Antibiotic with amoxicillin. Right? So both are home-based treatments. Now comes severe pneumonia. Yes, there can be severe lower chest indrawing, but on top of that, in severe category, there is central cyanosis if present, and saturations are falling. That means respiratory distress is present, lethargy, convulsions are present, and very importantly, the child is unable to drink or breastfeed. If the child is not breastfeeding, it is also a concern. Child is unable to drink or breastfeed. Convulsions, lethargy, respiratory distress, decreased saturation, central cyanosis. When these kind of severe stuff are present, now this is the time to refer to a hospital or admit. Refer to hospital. And the treatment, what we give here is not oral, IM or IV. You can give ampicillin, or you can give benzyl penicillin. Benzyl penicillin or ampicillin is given plus gentamicin. So what are we trying to do here? We are classifying a patient based on the severity. If it is very severe, we are admitting the patient. So the place of treatment in both cold and cough and pneumonia with or without chest indrawing is home, whereas severe pneumonia, we need to hospitalize the patient. Okay, so we won't be following this criteria for less than 2 months of old child. In less than 2 months of old child, we'll only look at the severity features, not rest of the stuff. Okay, so this is all about the latest acute respiratory insufficiency protocol.